So first, why would you delay umbilical cord clamping at all? Well, remember, the baby is inside the womb, inside of mom, and is attached to mom essentially via an organ called the placenta. The placenta is attached to the uterine wall. This is the location where there is gas exchange between mom and baby and where key nutrients get delivered. So after the baby comes out of mom, the placenta is actually first still attached for a little bit, but even when it's not, there is it's like a sponge. There's a bunch of blood that is still present in the placenta. So if you don't clamp the cord, then blood will continue flowing from the placenta to the baby. The key component of blood that we'll talk about a lot today are red blood cells. These are the oxygen carrying parts of the blood itself, and they contain something called iron or heme, and it's going to come up over and over again, so just note that for now. How much blood are we talking? Well, basically in the first minute, if you don't clamp the cord, then about 80 mLs, or just short of 3 ounces, is transferred from the placenta to baby. Within 3 minutes, about 100 ml, so just over 3 ounces is transferred. And I know that doesn't really sound like that much, okay, 3 ounces, but the baby's blood volume is pretty small, so this actually amounts to like a 30% increase in the overall circulating blood volume that the baby has on board. And so first and most critically, what do the guidelines say? Well, there actually is a little bit of variability here, but the American College of Obstetricians and Gynecologists and then the AAP, or American Academy of Pediatrics, they say, well, hey, you need to wait at least 30 to 60 seconds. The World Health Organization is a little bit more strict and say, no, you need to wait at least 60 seconds. And then the American College of Nurse Midwives is the most intense, and they say, no, you need to wait 2 to 5 minutes. So for me, I think anybody who waits between like 60 and 90 seconds, that's probably a good target. It's in line with most of the guidelines. And what I said to my obstetrician was, hey, can we wait 90 seconds? To be honest, the OB said, hey, the placenta's already transferred so much, we're just going to stop here at like 60 or 70 seconds. But, I kind of let it go. Wasn't that big of a deal because it was still within the realm of the guidelines. So we talked about the logic of why you would do this, but then what is the real benefit? Like, what's the outcome for babies that gets improved? And so it all has to do with iron and red blood cells like we talked about before. So just again, red blood cells are the part of blood that carry oxygen. Red blood cells have something called heme or hemoglobin in them, and this is made up of iron, and that's what actually carries the oxygen. So if you give a bunch of blood, which is red blood cells, from the placenta to the baby, then you're first giving red blood cells, which means more ability to carry and deliver oxygen, but you're also giving a bunch of iron. So it's as if you're giving a bolus or a big push of a big IV dose of iron. So what does this mean? Well, immediately, and this is kind of obvious, but you will have a higher hemoglobin level or a higher blood level in the baby at 24 to 48 hours, and this generally means improved oxygen delivery. More importantly though, because you're giving this big rich store of iron, that effect actually lasts like 4 to 6 months. And so there is a lower risk of anemia, which means low red blood cell numbers, and iron deficiency, which means low iron, at 4 to 6 months. Why is this important? Well, it's not just that anemia is bad for growth, but it also is correlated with neurodevelopmental outcomes. So this hasn't been borne out fully in the literature, to be very clear. But there is a risk that if you develop iron deficiency anemia, that your child may actually end up with a lower IQ or worsened neurodevelopmental outcomes over time. So the bottom line is whether you're term or preterm, you want to wait at least 30 to 60 seconds. And in my mind, 60 seconds is a good target to shoot for to try to get those potential neurodevelopmental benefits and immediate benefits in iron and hemoglobin levels. Now, if you're a premature infant, so if it's a child who's born at less than 37 weeks, then it becomes, truly a matter of life or death, where you really, really want to emphasize delaying the umbilical cord clamping. There is about a 30% reduction in the risk of mortality in infants who are born premature if they do delayed umbilical cord clamping versus immediate clamping. But not only that, there's also a lower risk of brain bleed, so this is intraventricular hemorrhage, by 25 to 30%. There's a lower risk of necrotizing enterocolitis, which is basically where you have this really bad inflammation of the intestines. It commonly happens in premature infants. It can lead to surgery, death, sepsis, awful things, and that goes down. There's lower risk for respiratory interventions. There's fewer transfusions. So if it's a premature infant, then most physicians will really emphasize trying to delay that cord clamping to get all these benefits. All right, so it all sounds pretty good so far. So what's the catch? Well, basically there are two things that you'll commonly hear about. One is what's called polycythemia, and this basically is just a fancy word for too much blood or too many red blood cells around. And this is kind of obvious, right? So if you're giving extra blood to the baby, then there's the risk that you will give too much or they'll have too much. In general, this is what we call asymptomatic, and so you never really know it, it doesn't really matter, and it just resolves over time, so nothing really to worry about. In extreme cases, it can actually cause sludging, making the blood too thick, which can cause problems in the brain or the lungs, but again, that's pretty rare, so I wouldn't worry about this one too much. The other one is the risk of jaundice. So first, what is jaundice? Well, it's that yellowing of the skin that affects basically 40% of term infants and 60% of preterm infants just at baseline. Forget clamping or unclamping the umbilical cord. How does it work or what happens? Well, basically, the yellow that you see is from bilirubin. Bilirubin is a byproduct of red blood cell breakdown. So how is that relevant here? Well, if you delay umbilical cord clamping, then you get more red blood cells from the placenta into the baby. More red blood cells means more red blood cell breakdown. More red blood cell breakdown means more bilirubin, which means more jaundice. And so the idea is that if you do delayed cord clamping, there's an increased risk of jaundice and the need for phototherapy, which is the primary treatment for that hyperbilirubinemia or jaundice. How much does it go up? Well, basically, the overall population is only about 2.7% of kids that will need phototherapy to treat jaundice, even though it's quite common. That's when you have really, really high levels that it needs to be treated. This will increase to 4.4%. So still pretty low overall, but it is like a 60% increase in your risk. What happened for me? So I will say my child actually did need phototherapy. I'm not really sure if this was related to the delayed cord clamping or not. You know, there was an uncle on my wife's side, and then, you know, maybe one of my aunts needed phototherapy, so it could have been a family predisposition. But besides the delayed cord clamping, we honestly didn't have anything else to point to for why her bilirubin levels got so high. So it's definitely a possibility in my mind. In general, I will stand by that the benefit of delayed cord clamping outweighs the risk of phototherapy. Having gone through it, I will say that it's not so simple as to say, oh, put the baby under some lights and that's it. I mean, this is a pretty tough thing to go through because, you know, on day 2 of life, you have a newborn at home. And I'm a pediatric ICU doctor, but I'm kind of there freaking out with my wife. I'm like, man, is our kid okay? Is she acting normally? Do we need to go to the hospital? Eventually we do. That means really 2 days in the hospital. When you're there, breastfeeding gets interrupted. You have to supplement with bottles because pooping is one of the best ways to get rid of bilirubin. So it really affected our breastfeeding and all these other things. So I just want to say this isn't a nothing effect, not nothing to worry about, but on balance, 100%, I think that delaying that at least 30 to 60 seconds is still definitely in the child's best interest, even with this risk of increased jaundice and need for phototherapy. All right, so those are the main risks, but what about contraindications, or when should you actually not do this at all? And I would say basically just think if mom needs resuscitation or baby needs resuscitation, then you have to prioritize that. This is just not the time to worry about a little bit of extra blood getting to baby, getting more iron, maybe neurodevelopmental outcomes. You need to protect mom and you need to protect baby. And so that just takes precedent right there. So if the baby comes out and they're not vigorous, so they're not crying, not breathing on their own, frequently they will need positive pressure support or breathing through a bag mask or even a breathing tube. In that case, the resuscitation must happen, so they'll clamp immediately and go. I will note there are some institutions that are working on how to resuscitate babies while they're still attached to the umbilical cord. And so if you're at one of those institutions, that's awesome. But if you're not, I would not try to pressure the team to do it because that can just lead to bad things happening if they're doing things outside of their comfort zone. Similar for mom, so if mom is having a big hemorrhage or she's bleeding a lot, and then if there's any sort of like cord emergency, so if the placenta, detaches in a funny way, if the cord is wrapped around the baby's neck or anything like that, then you really want to say, hey, let's just make sure that baby is safe, mom is safe, and we don't emphasize the cord clamping delay. All right, and to finish, let's talk about some special considerations. So sort of like a potpourri of topics that are important. So first, with C-section, yes, you should still do delayed cord clamping. There really shouldn't be any issues. Just talk to your OB about it. with twins, so it's possible, especially if there are separate placentas, if there's a single placenta that they share, then you need to talk to your OB about it. I would tend not to do it personally. There's some concerns about how the blood flow will go to each of the babies individually, and maybe hemodynamic effects. So will they keep their blood pressure and heart rate in a normal range? So, talk to your physician. That's every sort of individualized decision, but I'd probably shy away from it. And then cord blood banking. So I personally am not sold on this as a practice. I don't think that there are enough reasons to actually do cord blood banking outside of some very specific circumstances. But you should know that if it's something you're interested in, that if you do delayed cord clamping, you can still get cord blood, but it will likely reduce the likelihood that you get a sufficient sample. So the ACOG says it'll probably take your chances of getting a good sample from 39% down to about 17%. So something to keep in mind. And then the last thing is just where the baby is held really doesn't matter. So if the baby is attached to the umbilical cord and placenta on mom's chest, below the vagina or the level of the placenta, or anywhere in between, it should be fine and blood will still be flowing normally. So, okay, what do we learn? Basically, delayed umbilical cord clamping is a pretty good thing overall. My personal vote is to shoot for 60 to 90 seconds, but if you do at least 30 to 60 seconds, then you're really in line with most of the guidelines. There are some small downsides to worry about, but even as somebody who was negatively affected by those downsides, I still stand by delayed cord clamping. I'll do the same thing with a subsequent pregnancy or my next child. And so I really don't have many reservations about recommending that. And so hopefully that was helpful. But what about other newborn procedures? So you have to make other decisions about hepatitis B, vitamin K, erythromycin eye ointment. And so definitely check out my other video on those decisions as well. And no matter what, if you enjoyed it and you're willing to either subscribe, give a like, or drop a comment below, would love to chat with you and engage and really appreciate your attention. Thanks.